We are Healthcare Partners of Nevada. We promise to earn and keep your trust.
We promise to treat you like family.
We promise.
We promise to be an important part of the prompt community.
We are Healthcare Partners of Nevada.
We're Healthcare Partners of Nevada.
We are Healthcare Partners of Nevada.
Contact us today to learn more about our promise to patients and to find out how you can see a Healthcare Partners doctor.
What is the role of genetics in heart disease? Let's talk about coronary disease, the disease that causes heart attacks, sudden death, congestive heart failure, over 1.5 million cardiac events per year, and is the number one cause of hospitalization of adults in not just the United States, but throughout the world. What's the role of genetics? What I'd like people to know is there's really actually a very easy tool that you can use to calculate your own heart risk, meaning your risk of a heart attack or a stroke. There's a website. You can go to qrisk.org. And in qrisk.org, you don't have to be a doctor to go to that. You just go to that website, and it's going to ask you about 10 questions. It's going to ask you about, your family history. It's going to ask you your blood pressure, your height, your weight, your cholesterol to HDL ratio, which you can get from your doctor. Most patients in this town have had that blood panel done. It's called a lipid panel. It's just a basic cholesterol, triglyceride, HDL. It's nothing fancy or esoteric. You plug all those numbers in, and it will tell you what your 10-year risk is of having a heart attack or a stroke. And you can play with that. You can change the numbers, change the parameters. And in the box that allows you to click family history, and for our purposes and our patients' purposes, we're talking about a parent or sibling who had a heart attack before age 60. If your father had a heart attack at age 89, that's not a risk factor for heart disease. We're talking about premature risk. So if you play with that, you'll see that the family history, as I just defined it, has a role. But it's not huge. It's these other things that you can change. Smoking, blood pressure, weight. These are the things, your sugar level, whether you're diabetic or not, how well that's controlled, that really modify your risk going forward. So although genetics is important, and a lot of lab companies tout very expensive tests to look at your genetic profile, at the end of the day, it doesn't affect your risk as much as all the other things combined. And here's the other thing, you can't change your genetic profile. You're born with that. So you have to focus on the risk factors you can modify.
So this all comes down to something so simple. You are really in charge of your own health.
Let's put that in a perspective. Statin drugs, which are the best medicine we have to decrease heart and stroke risk, along with a daily baby aspirin in people for whom that's appropriate. Just doing that eliminates only 30% of your risk. But if you have a daily exercise regimen, you don't smoke, your blood pressure is controlled, you're not diabetic, and your cholesterol is controlled, you eliminate 95% of your risk.